Is there a better way to teach people how to take their medicines after surgery? I think there is. I've been trying to find a way to do this for years. Please let me know if this works for you. All right, so depending on the surgery, you'll be given up to 7 different medicines, sometimes 1 or 2 more, sometimes less, but these are the most common ones. All right, in the morning, you're going to wake up and you're going to decide to take, not decide, but you're going to take your antibiotic, your non-narcotic pain medicine, and your stool softener. Then you will ask the question, are you having more pain or more spasm, depending on the type of surgery? If you are having more pain, then let's go on and take our pain medicine. In this case, it'd be the Norco. And a few hours later, we're going to take the Flexeril. Once we get back to the evening time, we're again back to the 3, the antibiotic, the non-narcotic, and the stool softener. But what if we're having more of a spasm type day? Well, then we'll start over here on the spasm side and we'll take the Flexeril. We'll then, a few hours later, take the Norco, the narcotic pain medicine, if we need it. And then, of course, we get to the PM, the evening medicine will be the antibiotic, the non-narcotic medicine, and then the stool softener. I hope this helps guide you a little better, and I wish you an uneventful recovery period.